This process will place the state's actions under the microscope, and we should be mindful of the scale of that undertaking and the resources required to do it properly. The exercise of identifying and disclosing all relevant information, the months of preparation and retrospective analysis, and the time that people will have to spend testifying in public, in some cases for days, will place a significant burden on our NHS, on the whole of government, on our scientific advisers, and on many others. We must not inadvertently divert or distract the very people on whom we all depend in the heat of our struggle against this disease. And the end of the lockdown is not the end of the pandemic. The World Health Organization has said that the pandemic has now reached its global peak and will last throughout this year. Our own scientific advisors judge that although more positive data is coming in and the outlook is improving, there could still be another resurgence in hospitalizations and deaths. We also face the persistent threat of new variants, and should these prove highly transmissible and elude the protection of our vaccines, they would have the potential to cause even greater suffering than we endured in January. And there is, in any case, a high likelihood of a surge this winter when the weather assists the transmission of all respiratory diseases and when the pressure on our NHS is most acute. So I expect that the right moment for the inquiry to begin is at the end of this period in the spring of next year, spring 2022. And Mr. Speaker, I know that there will be some in this chamber and many bereaved families who will be anxious for this inquiry to begin sooner. So let me reassure the House that we are fully committed to learning the lessons at every stage of this crisis. And we've already subjected our response to independent scrutiny, including 17 reports by the Independent National Audit Office and 50 parliamentary inquiries already. And we will continue to do so. We will continue to learn lessons as you have done throughout the pandemic. But no public inquiry could take place fast enough to assist in the very difficult judgments which will remain necessary throughout the rest of the year and the remainder of the pandemic. And we must not weigh down the efforts of those engaged in protecting us every day and thereby risk endangering further lives. Instead, this inquiry must be able to look at the events of the last year in the cold light of day and identify the key issues that will make a difference for the future. Free to scrutinise every document, to hear from all the key players and analyse and learn from the breadth of our response. And that's the right way, I think, to get the answers that the people of this country deserve, and to ensure that our United Kingdom is better prepared for any future pandemic. Mr. Speaker, entirely separately from the inquiry, there is a solemn duty on our whole United Kingdom to come together and cherish the memories of those who have been lost. Like many across this chamber, I was deeply moved when I visited the COVID memorial wall opposite Parliament. And I wholeheartedly support the plan for a memorial in St Paul's Cathedral, which will provide a fitting place of reflection in the heart of our capital. I also know that communities across the whole country will want to find ways of commemorating what we have all been through. So the government will support their efforts by establishing a UK Commission on COVID commemoration. This national endeavour above party politics will remember the loved ones we have lost, honour the heroism of those who have saved lives and the courage of frontline workers who have kept our country going, celebrate the genius of those who created the vaccines, and commemorate the small acts of kindness and the daily sacrifice of millions who stayed at home, buying time for our scientists to come to our rescue. We will set out the Commission membership and terms of reference in due course. And in telling the whole story of this era in our history, we will work again across our United Kingdom together with the devolved administrations to preserve the spirit which has sustained us in the gravest crisis since the Second World War, resolving to go forwards together, Mr. Speaker, and to build back better, and I commend this statement to the House.